All right, Chair Young, you are live.
Thank you so much, Megan. Welcome everyone to this special call meeting of the Kentucky Board of Education via video teleconference, August 12, 2021. Welcome back to members and to our viewing audience, as well as those who are in attendance there at the Kentucky Department of Education building. A few notes to announce about conducting virtual meetings. As you know, the meeting must comply with the requirements of the Open Meetings Act. Therefore, Kentucky Board of Education members must ensure that your video is streaming and that you can be seen throughout the duration of the meeting. Members, as always, please mute your microphone when not talking. However, all discussions must be broadcast to the public, so be sure your microphone is not on mute when you speak. For any item that requires a vote, a roll call vote will be necessary. To record the vote of each board member at that time, just say your name and record your vote. Also, please remember to silence any electronic devices or other noise-making devices that may cause disruption to your sound feed. And Meredith, if you would, please call the roll.
Joanne Adams.
This is Joanne Adams, here.
Claire Batt.
Claire Batt, present.
Holly Bloodworth.
This is Holly Bloodworth, here.
Jamie Bowling.
Jamie Bowling, I am present.
Alvis Johnson.
This is Alvis Johnson, I'm present.
Patrice McCreary.
This is Patrice McCreary, I'm present.
Randy Poe.
Randy Poe, present.
Sharon Robinson.
Sharon Robinson, present.
Lee Todd.
This is Lee Todd, present.
Lou Young.
This is Lou Young, I am present.
Lieutenant Governor Jacqueline Coleman.
This is Jacqueline, I'm present.
Dr. Amanda Ellis for CPE President Aaron Thompson.
Amanda Ellis, I'm present.
Allison Sloan.
This is Allison Sloan and I'm present.
Okay, Chair, you do have a quorum.
Thank you so much, Dr. Brewer. At this time, we will consider 702 KAR 1:195E, denoting an emergency regulation regarding face coverings in school facilities. And I'd like to turn it over to Commissioner Glass and Associate Commissioner Robin Kinney, who will provide an overview of the emergency regulation and accompanying documentary evidence.
Thank you, Madam Chair, and good morning, members of the board. I appreciate and I'm grateful for you coming together quickly to consider this emergency regulation, which comes forward as the state is experiencing an alarming surge in COVID-19 infections and hospitalizations, and an accompanying troubling rise in the number of cases with young people. While Governor Beshear has also issued an executive order on this matter set to expire 30 days from issuance, KBE's authority is separate from the governor's, and this board has an obligation to take steps to protect the health and safety of Kentucky students. The emergency regulation that the board is considering requires universal masking for a period of up to 270 days, or at such time that the state board rescinds that regulation. I understand that the 270 days is some concern, so I'd like to address that. The reason for the 270 days is because of state statute around the length of time for an emergency regulation. It is not something that we from the department side arbitrarily put into the proposed regulation, and none of us want to be in a position where we're requiring masks for the next 9 months. Still, based on feedback, we will recommend in your motion the addition of some changes that I think will satisfy the time concerns on this issue. While the proposed regulation currently does indicate that the board can end the requirement at any time, we'll also recommend that adding language in the motion directing this for a special board meeting to be called upon the CDC or the Kentucky Department of Public Health changing their recommendations for universal masking in schools. So we've crafted language around that in a model resolution for you to consider, or a model motion for you to consider, I should say. We believe that this clearly communicates that the state board is going to closely monitor this issue, and then it's not the intent of the board to require masking any longer than what is necessary. We also believe it's superior to putting some kind of arbitrary date at some point into the motion when our circumstances and conditions around COVID-19 continue to be so dynamic. Another difference from Governor Beshear's order is that we're recommending is that this KBE emergency regulation allow for people not to wear masks if they're alone in a room. The governor's order isn't clear on that point, but we've conferred with public health on the issue, and they agree that it's a very low risk of an individual. So we've included language in our emergency regulation around that. We look forward to your deliberation on this. I want to also mention that we met with the local superintendent's advisory council just before this. The purpose of that group is to provide recommendations to the state board on regulations, whether they fulfilled their obligation to do that this morning. I'd like to report to you that what they have recommended is that the state board delay or table any action on this item right now. And that the Kentucky Department of Education work with the Department of Public Health to develop a more localized approach that considers factors within a local community to determine what virus mitigation strategies, including masking, that should be deployed. So I appreciate all the work and thoughtfulness of the LSAC in bringing forward that recommendation to you. They really were thoughtful and took their time, and we had a really quality discussion on this regulation and what it means. Still, in spite of the regulation or the recommendation coming from the LSAC, it is my recommendation to you that you follow through on passing the regulation as it is proposed, but that we add those elements around bringing the board back together to consider ending it whenever we have a change in guidance from the CDC or from the Department of Public Health. I think to meet the spirit of what the LSAC is recommending, I also will reach out to Public Health to start immediately working on what a localized configuration might look like. If you recall back to this past spring, we did have a color-coded system that recommended different strategies be deployed based on the positivity rates in the community. We can work with public health on what that looks like. Again, as soon as public health were to change their recommendations around schools with the model motion that we provided, that would trigger a state board meeting where you'd come together and potentially revise this regulation based on that. So it is my recommendation to the board that you continue forward with this emergency regulation, but we make that accommodation based on the feedback that we received from the LSAC this morning. At this point, I want to bring on Todd Allen and Robin Kinney, who can review the components of the emergency regulation with you, and we're glad to answer any questions and support you in your deliberations. Thank you, Madam Chair.
Thank you, Commissioner. And before I turn it over to Todd, I would add, and I feel certain Todd will highlight this, but in relation to the 270 days, I really appreciated that clarity. Todd will add a lot of detail to that as well, but also call your attention to the introductory information in the regulation where we establish the rationale for an emergency. You'll see that there's language there that Todd can walk you through related to the fact that it is not our intent that this would span any days beyond what is necessary for the health and safety of our students. So that 270 days is required, is legally required in the regulation itself, but we can withdraw it when it's time to do so. And I also want to echo Commissioner Glass's thanks to LSAC. I had a chance to tune into their meeting this morning as well, and they grappled very sincerely with a lot of the issues that I know we've all been thinking about over the last few days as well. And so many thanks to those superintendents as well as the superintendents across Kentucky that are doing all they can to ensure that we have the best safe environment for our students as they return to school this fall. Thank you. Todd.
Thank you, Madam Chair. Thank you, Dr. Glass. I'll take a moment and share my screen with you and bring the regulation up so that everyone has an opportunity to follow along as we walk through it. And if you'll just let me know when you can see that.
Looks good.
Okay, great. So at the very first page, Madam Chair, as you indicated, this is the statement of emergency that is required for all emergency administrative regulations that sets forth the imminent threat to public health, safety, and welfare that we rely upon for filing this emergency regulation. I think the provision, I'll pause for just a moment to address this 270-day issue. And Madam Chair, what you were talking about, we have a statement in here that this emergency administrative regulation will not be replaced by an ordinary regulation because the promulgating agency, that is the State Board of Education, anticipates the imminent threat to public health, safety, and welfare will have substantially subsided upon expiration or withdrawal of the emergency regulation. The 270 days is not a number, as Commissioner Glass indicated, that we have arbitrarily chosen. The authority for the State Board to file all of its administrative regulations lies in KRS 13A. That's what we rely upon for all of the regulations that the board files. There's a specific provision in KRS 13A, it's KRS 13A 190, regarding emergency administrative regulations. The board will recall that when you all typically adopt either an amendment or a new ordinary administrative regulation, that's an extremely lengthy process from the time you adopt it to the time that it becomes effective. It's 270 days. So the logic behind an emergency regulation lasting 270 days is that it allows an administrative agency responding to an imminent threat to public health, safety, or welfare to file an administrative regulation that becomes effective the day that they file it and lasts for up to 270 days, which is the time that an ordinary administrative regulation could take its place and carry on after that. However, there is always a provision for a body, a promulgating agency like the KBE, to withdraw the emergency administrative regulation at any time during that 270 days. So statute sets forth the 270 days. It says when an agency files an emergency regulation, it is effective for 270 days. We don't get to choose a date range that it's effective or an amount of time that it's effective. And then how we get rid of that in less than 270 days is by the agency taking action to withdraw the regulation, which we state here that we, are certainly hopeful that we are beyond this emergency situation and are able to do prior to the 270-day period.
And Todd, that could happen within a matter of just a day or two, calling the meeting, making the ruling, and then you write a letter, correct?
That's right. As soon as I file the letter with the Legislative Research Commission, it is effective and the regulation is withdrawn. So next we get into the body of the regulation, and I'll call your attention on line 8 to the necessity, function, and conformity section. We have to file this for all of our regulations, but specifically I want to note the board's authority here lies in KRS 156-160, which provides that the Kentucky Board of Education shall promulgate administrative regulations necessary or advisable for the protection of the physical welfare and safety of the public school children here in the Commonwealth. So that is the authority that we rely upon in order to put this administrative regulation into effect. Let me pause there to see if there are any questions about the 13A emergency regulation process or KRS 156-160. I'll also note that the 13A administrative regulation process was recently amended by the General Assembly during the 2021 session, and the agency will fully comply with all of the changes that were made during that session. Okay.
Hey,
yes, sir.
I'm sorry. I do have a question just for clarification or trying to understand this legal thing. So I'm glad you're trying to explain it, but help me out just a little bit more, because one of the questions that I guess I don't understand is in relationship to this regulation being passed, this is what we are doing basically to help school districts out with this executive order, or with the executive order, no matter what we do on the KRS, still stands. Is that correct?
So the executive,
I just don't know. That's a clarification. I think I'm trying to understand from reading this, and I just don't understand it.
Sure. The governor's executive order was entered under his authority as the governor of the Commonwealth, and the authority that he relies upon is KRS 39A, which are emergency powers that are granted to the governor. The regulation that's before you today relies on completely separate authority that is specific to the Kentucky Board of Education. So it's really two completely separate actions that we're talking about. There are provisions in law for an administrative agency that once an executive order is entered declaring an emergency, that then the agency can utilize that authority to file an emergency administrative regulation, but that's not what we're doing here, because the KBE's authority to file this regulation is in KRS 156-160. Does that clarify your question, Dr.
Yeah, I just wanted to clarify, and I think you did a good thing there. That in absence, it's not that this KAR that we're looking at could supersede what the governor in the executive branch is doing. It's totally separate in and of itself. So you still have to comply with the executive order.
Yes.
As somebody out there, even if we didn't pass what we're passing, they still have to comply with that executive order, correct?
Yes, that the agency's understanding is that that executive order has the force and effect of law. And yeah, so obviously.
Okay, thank you. That's the clarification I needed. Because, you know, in reading all the emails, I think there's this misinterpretation out there that we can supersede one thing or the other, and no, we can't, because that's a rule of law and in effect by itself.
Right. Yeah.
Thank you for that clarification, because that clarifies, at least to me, to all the emails that I've been reading and trying to, you know, decipher. I think that's a confusion out there, and I think you clarified that very well. So thank you.
Sure. So getting into the regulation itself, in Section 1, we define 3 terms that we're going to use throughout the regulation. First, we define face covering. That will mean a material that covers the nose and mouth to prevent respiratory droplets from being expelled into the air, and that is secured to the head with ties, straps, or loops over the ears, or is wrapped around the lower face. It may be made of a variety of materials, including cotton, silk, or linen. It shall have 2 or more layers, and it shall be factory made, homemade, improvised from household items such as a scarf, bandana, or t-shirt. So you can see that the definition of a face covering is quite broad, to allow folks to make their face coverings at home, use store-bought face coverings, as long as they meet this minimal requirement that it covers the nose, the mouth to prevent respiratory droplets. It's secured to the face in some manner, and that it has 2 or more layers. The next term that we define is a person with a disability. That's any individual with a disability pursuant to the Individuals with Disabilities Education Act, the Americans with Disabilities Act, or Section 504 of the Rehabilitation Act of 1973. And those are provisions that school districts are very familiar with in accommodating their students and staff with disabilities. And the final term that we define is a school facility. It means a building, enclosed structure, or vehicle that is owned, leased, or operated by a school district, and where 1 or more students are present therein. So a school facility is only a school facility for the purposes of this regulation when students are present inside the facility. Next, Section 2, face coverings required in school facilities. All individuals, including students, employees, contractors, visitors, shall cover their nose and mouth with a face covering while inside the school facility. And again, that's defined to be while students are present therein. School district superintendents shall implement procedures to ensure face coverings are worn in school facilities as required by this administrative regulation. And school districts shall provide face coverings to individuals in school facilities who do not furnish their own face covering, but shall not be required to provide more than 2 face coverings to any single individual. And that's to reasonably limit the expense to school districts related to that. This administrative regulation shall not prevent a school district from establishing and implementing policies or procedures that establish face covering requirements in addition to those set forth herein. So if school districts want to have more stringent requirements on masking than are provided in this regulation, they can do so. For example, if a school district wants to require face covering in its facilities, regardless of whether students are present, they may do so, so long as they're complying with the requirements of this reg. And then section 3, we have a host of exemptions from required face coverings, and we'll walk through those. Children who are under age 2 would be exempt. Any person with a disability whose disability prevents the person from safely wearing a face covering, or any person with a physical or mental impairment documented by a medical professional as preventing the person from safely wearing a face covering, any person who is deaf or hard of hearing and is actively communicating, or any person who is actively communicating with someone who is deaf or hard of hearing and is able to maintain a distance of 6 feet from all individuals who are not members of the person's household, any person engaged in work that a state or federal regulator has concluded would make wearing a face covering a risk to their health or safety, any person who is seated and actively consuming food or beverage, any person who is obtaining a service that requires temporary removal of the face covering in order to perform the service, any person required to temporarily remove the face covering to confirm their identity for security or screening purposes, any person giving a speech or broadcast to an audience and is able to maintain a distance of 6 feet from all individuals who are not members of the person's household, any person who's in a swimming pool or other body of water, any person actively engaged in exercise, any person who is engaged in a lawful activity where federal or state law prohibits wearing a face covering, any person who is sleeping or unconscious or who cannot otherwise remove the face covering on their own, or finally, any person who is in an enclosed room and no other individuals are located inside the enclosed room other than individuals who are members of the person's household. So for that one, if a teacher is located in his or her classroom alone, they can remove their face covering. Let me pause there to discuss any questions about this language, and then Associate Commissioner Kinney will also cover some additional information with the board.
And I see a hand while Robin is opening up there. Let me call on Dr. Robinson and then Dr. Poe.
Thank you, Chair Young, and thank you, Todd, for that walkthrough of the regulations. A number of the emails raised questions concerning the directions or how these regulations will accommodate students with special needs and the various modalities of instruction or service that they might be receiving. Will we work with school districts to make sure those parents' questions get addressed, or the parents of students in special needs programs will be confident that they are supporting the continuation of those services for their children?
Thank you, Vice Chair Robinson. I believe the goal of the department is to provide guidance to school districts, further guidance, non-regulatory guidance, obviously, to interpret the regulation. And I believe we also have Associate Commissioner Hilton on the line as well, who may have specific information with regard to students with disabilities.
Thank you so much.
Yes, thank you, Todd, and thank you, Dr. Robinson. That's a fantastic question. And as Todd mentioned, we are actually working on non-regulatory guidance to help schools and districts with that challenging situation, because you're exactly right. As we think about the needs of students with disabilities, we are going to have to be sensitive to the disability, and it is going to require those admissions and release team members to come together and determine if a student is unable or unwilling to wear a mask due to the student's disability, then appropriate accommodations must be provided for that student.
Thank you, Dr. Poe. Oh, pardon me, Dr. Robinson. All
I
right.
appreciate that. Thank you so much.
Thank you. And Dr. Poe?
Yeah, that was a basic part of my first question. So thank you for asking that. That was a great clarification because that was several emails that I received too to make sure that we're not violating that. The other question that I have, or for clarification, is when we say any person, that includes children. I know the children have to be supervised in that particular setting, but if a child, for example, happens to be in the library and another person is supervising behind the glass door, that particular child, like a teacher. So we're treating students and adults that are alone fall under that any person. Is that correct?
Yes, the way the regulation is written, the exemptions apply to any person, regardless of whether they are student or staff member. Okay, great. And I think the other thing that's misinterpreted too on this from some of the ones that are reading that when, just like here with the swimming, and you're in that particular thing. So if students, if teachers are taking the opportunity to go outside and work in their classrooms, once again, if they're outside appropriately spaced, they do not have to be masked at that particular time also, correct? The regulation only applies to indoors, inside school facilities. So any outdoor activity is not covered by this regulation.
Right. Thank you for that clarification, because I was in a lot of different emails thinking that children had to be masked from the moment that they got onto the bus to the moment they got off the bus going back home. And once again, that's when I was reading it was not that case. You know, I'm just doing this for clarification from a lot of the emails that I received and so forth. So that's a good thing. Now, the other thing is when trapped, because of the defined space that we're talking about, because it said any person that's seated, if I'm in the office or I'm moving from the office to a classroom and there's nobody in the hallway, I just want to make sure if the person's walking in the hallway back to class and they remove their thing, if there's nobody out there, this is a situation where we're not telling superintendents that they're disciplining that particular child who's walking to the classroom if they stop and get a drink of water and remove their mask and so forth and put it back on, correct? I mean, that's the other types of things that were in emails, and I'm saying, no, that's not the case, but I just want to make sure.
Right. So there's a provision for food and beverage, obviously, that in order to consume food or beverage, the student or staff member can remove their mask for that. We also have exemptions in place for when the student is receiving a service. So perhaps if they're receiving medication in the office or some other service that requires them to remove the mask in order to receive that service, those exemptions are built in to allow that to occur.
Okay. Thank you for the clarification.
But to just reiterate two things, on the bus is indoors for the purposes of this regulation, and Randy, the seated only applies to when eating and drinking. So
You froze up there. I didn't hear your second part there, Lou. Yeah, I know the bus, but.
Yeah, my apologies. Am I back?
Yes.
Okay. And then the second part, the seated, applies to when eating and drinking. So I think I heard your question at the end was getting a drink of water in the hallway, right?
Correct. I mean, we have, you know how we go to the restroom and a kid comes back to take a drink of water from the water station. They're allowed to remove their mask to take their drink of water as they're going from class back to class and so forth. We're not shutting down water fountains and things like
that. Districts may be. This regulation does not address that.
Okay. Thank
you. Then Commissioner, then Holly.
Thank you, Madam Chair. Just a quick point that what we are putting forward here is largely a restoration of the masking procedures that were in place this past year. So the operationalization of these masking requirements is something that districts know how to do, that they're experienced with, and they're putting in place the practices that were proven effective this past year. So just wanted to score that point.
Yeah, I'm so glad you mentioned that too as a reminder. Yeah. Thank you. Holly.
Does, like, when you're teaching phonics and that kind of thing, like in a lower elementary classroom, is that considered a service? Like, could you could you remove your mask to demonstrate how to form a sound, that kind of thing, if you're far enough back. But that's pretty important for the beginning readers.
Yeah, so Ms. Bloodworth, there may be some other associate commissioners on the line who want to address that topic, but the way the regulation is written, it seems to me that would be considered a service that the mask needs to be removed. Like you said, if you're demonstrating for a student how to pronounce certain speech sounds. I'm certainly not a speech pathologist, so I won't venture into that area, but that could certainly be a service that the mask may need to be removed in order to receive that.
Right, and think too, Polly, about one-on-one or small group speech services where articulation is the goal of the lesson that day. That would be an example where removing the mask and moving further apart would be appropriate.
Yes, I understand that, but I'm talking about just general phonics instruction when you're first learning your letters and sounds in kindergarten.
In a larger classroom.
Mm-hmm.
Yeah. And so I can't see the associate commissioners who are on the call.
Well, Madam Chair, if I might, I would just address that. I think Board Member Bloodworth, I would consider that specific circumstance that you described as receiving services. That's an educational service that a student is receiving, so that would qualify for the exemption. So in that case, the student would remove the mask, perform whatever is required of them from a learning standpoint, and then reapply it. That is something that we can address in the non-regulatory guidance that will accompany this.
And Ms. Bloodworth, I'll also note that there's an exemption written in the regulation for any person who is giving a speech or broadcast to an audience and is able to maintain a distance of 6 feet from all individuals who are not members of their household. So that would likely apply in the situation that you present as well to the teacher giving that speech or broadcast to the class.
Okay, thank you.
All right. Thank you. We still have time for further questions as they may arise. In the meantime, I think Associate Commissioner Kinney is going to take us through the documented evidence, which you also have in the portal, and will also be available to the public with the regulation itself.
Thank you very much, Chair Young. It's a pleasure to be with you all again today. As Todd Allen explained to us, under KRS Chapter 13A, which is the statute that governs the process of administrative regulation promulgation, it was revised in 2021 with some new requirements. And one of those is to, whenever you're doing an emergency regulation, to provide documentary evidence of the reasons on why you are asking for an emergency regulation to be promulgated. So we wanted to share with you just a little information that, again, as Chair Young said, is publicly available and has been provided to you, but to quickly walk through some of the evidence that we will be providing with the emergency regulation in support of this happening so quickly. I think we all know, because the coronavirus continues to be a topic of discussion and in the media and the news all the time. But right now, we are in a little different place with alarming evidence, which sets forth increases of the diagnosis of COVID-19 in children specifically, and hospitalization of children. And so provided as part of the documentation, we have an August 9th report from the Kentucky COVID report indicating 269 new cases were reported for ages 18 and under in a single day, representing 20.1% of the total new cases on that day. It's just a snapshot of one day, but we continue to see more and more cases that are impacting our students. The Centers for Disease Control and Prevention, or CDC, the new admissions of patients with confirmed COVID-19 per 100,000 population by age group, and this is looking at the Health and Human Services Region 4, of which Kentucky is a part, shows that we are currently experiencing the highest level of hospitalization of individuals 0 through 17 from at any point in time during the course of the COVID-19 pandemic. The CDC cites to 12,414 total COVID hospitalizations of this age group between August 1st and August 8th of 2021. So only in 1 week, we see those numbers of over 12,000. Also included as part of our supporting documentary evidence is a recent document dated August 6th of 2021, published by the CDC again, which explains the science related to this new, fairly new type of variant called the Delta variant. The Delta variant right now is the predominant strain of the virus currently, and the unvaccinated population, according to the CDC, is the greatest concern for us. Currently, children across the nation younger than 12 years have not been approved to receive vaccinations, although we're really hopeful that we'll get there soon. And less than 34% as of this week of children 12 to 17 in Kentucky have received a vaccination, even though it is available. In the publication, the CDC indicates that the Delta variant is highly contagious, nearly twice as contagious as previous variants, and that patients are more likely to experience severe illness. As a result, the CDC document that we have provided concludes, given what we know about the Delta variant, vaccine effectiveness, and current vaccine coverage, layered prevention strategies, such as wearing masks, are needed to reduce the transmission of this virus. Additional evidence that we have provided, this is a really, really busy week for our school districts. Last week and this week, it is back to school time, and people are excited to go back to school in person. However, as part of our supporting evidence, we've also included evidence from media outlets that are reporting in Kentucky and other states that are not utilizing the mitigation strategy of universal masking. It is now impacting both students and staff and causing disruptions in their operations moving forward. Additionally, we've provided the Centers for Disease Control and Prevention August 5th, 2021 guidance for COVID-19 prevention in K-12 schools. And the CDC in that guidance really starts off at the very beginning and explicitly states, students benefit from in-person learning, and safely returning to in-person instruction in the fall of 2021 is a top priority. It really is the common goal of both medical professionals and educational professionals to have in-person learning happening for our students. And as a result of that, the CDC further recommends universal indoor masking by all students aged 2 and older, staff, teachers, and visitors to K-12 schools, regardless of their vaccination status. Finally, as part of our documented evidence, we've included 2 studies, reports, one from the Center for Disease Control and Prevention, November 16th of 2020, titled The Science of Masking to Control COVID-19, and a Boston University School of Public Health publication of February 10th, 2021, which reaches similar conclusions on the benefits of masking to mitigate the spread. Masking, I think this is all the supporting data that we have included as we're filing. There is a plethora of more supporting evidence that it's out there from our medical professionals and the science that we're relying upon. We hope that this mitigation will just be another tool in our toolbox. We need to continue with vaccinations, encouragement of vaccinations for our students and staff, social distancing, hand washing, sanitizing, testing, all those other public health measures that are going to get us back in school in person and allow to continue that in-person instruction. So wanted to share with you the basis on which the department has worked to document the need for this emergency regulation as an imminent threat to public health and safety. I'll stop there, and again, the Commissioner Glass, Todd, and I, are, as well as other associates, are on the line to answer any questions.
Excellent. Thank you so much, Robin, and for your whole team as you've worked in tandem with the Department of Public Health to gather that documentary evidence required. Board members, I'll be opening it up to further questions and additional comments as you begin to deliberate. First, I'd like to thank Commissioner Glass, Todd Allen, Associate Commissioner Kinney, and the entire KDE team for all you guys have done to set the stage for today's meeting. I also want to thank the folks who took the time to phone and email me and my fellow board members, some in favor of the mandate, some opposed. Having read every single one of those emails and having reviewed a great deal of data and opinion on the subject, including very clear messaging from the American Academy of Pediatrics and the CDC, along with the documentary evidence included with this emergency regulation in your board portal, I stand in strong support of the face covering mandate for all educators, staff, students, and visitors in our schools who are able to wear masks for the following reasons. While mask wearing alone is not a singularly effective strategy, Kentucky schools have already proven last spring that a layered mitigation approach led to returning our students to in-person learning and kept them there. Please hear me when I say that returning students to in-person learning and keeping them there in school is our main goal as we consider these regulations today. In conjunction with vaccinations, social distancing, hand washing, and other hygiene efforts, mask wearing has already proven effective in Kentucky schools, and in fact helped us stave off serious disease transmission in our schools last school year. I am confident that the same layered approach will go a long way toward keeping our students in school in person through this latest surge. The wearing of face coverings will also reduce the number of students who have to quarantine out of school this fall based on CDC and Kentucky DPH guidelines that schools are required to follow. So let me reiterate, I really believe that this is a very practical strategy to reduce the number of days that our students and faculty and staff would otherwise have to be in quarantine away from school. When there is a positive COVID exposure in a classroom, students who have not been in close contact with the infected person and have been wearing masks will likely not have to quarantine, decreasing time away from in-person learning and keeping schools in session, a huge improvement over where we were in our schools last year. Again, returning students to in-person learning and keeping them there is our priority. My sincere hope is that we can act together to keep our kids and communities safe and to finally put this virus behind us for good. I also have a message from our student representative, Soliana Mesfin, who is taking a test right now on day 2 of school. Soliana asked me to share her comments with you, and she wrote, "As with the majority of education issues, this topic surrounding statewide mask mandates barely has student feedback. Each and every student has a valid experience with masking and assimilating back into our schools, which is too diverse for me to represent as a whole. What I can say is implementing a mask mandate will put us on a path to obtaining normalcy within our schools that students so yearn for. With the return to schools this past year, students hoped that they would be able to express themselves in their school setting in a way that they were deprived of last year. Without a mandate put in place, there is a higher chance that we will return to online and less interactive learning environments. This will exacerbate inequities and create many underlying issues for students that school systems will have trouble providing for. Students continue to face these challenges, and mandating masks will expose them to resources that better them and their education." I also received an email this morning from the Kentucky Student Voice team in support of the mask mandate, and they also asked me to share. While we were hopeful to return to school without masks, rising COVID-19 rates and the spread of the Delta variant have made doing so unsafe. Despite what some have said about the negative effects of wearing a mask in school, public health experts tell us that masks are the least invasive way to protect students and ensure a return to the type of education experience we know and miss. Without a mask mandate, our districts are more likely to be compelled to move school online or risk further spreading COVID-19 among students, their teachers, and their families. We know that online learning exacerbates disparities for young people with poor internet access, with parents who cannot work from home, and with special needs, and from other marginalized communities. But with a mask mandate in place for our schools, we can better ensure that these students receive the resources they need and fewer of us suffer from the worst effects of COVID-19, and that we receive the fullest possible education experience. Board members, feel free to unmute, share any questions that you may have and or comments that you would like to share as we continue the deliberation. Patrice McCrary.
Thank you, Chair Young. Our large school district is in session. It has been in session for 5 days now. On day 4, the masks were optional. Approximately 10% of the students were masked. By day 4, we had over 1,000 students in quarantine. That's over 1,000 students who are not able to be in school right now. A mask would have significantly cut that number. Our goal is to get children in school and keep children in school. Research shows in the spring that those masks were effective.
Excellent. Thank you so much, Mrs. McCrary. And then Dr. Poe, followed by Ms. Sloan.
Yes, I have a couple follow-up questions for Ms. Kenny in relationship that were asked that is in some of the emails. And I think I already know the answers to these, but I just want them on the record to be clarified. There are some schools at the beginning that chose the virtual option to host kids, especially now that those students are quarantined. If they didn't check that box and say we want to offer virtual prior to this pandemic because they were all planning on being back, they'll have that option to appeal to you all too, so that they can now start offering the virtual option that some did not check for elementary school, correct? So you'll provide them with that flexibility, correct?
Dr. Poe, that is correct. I do think Associate Commissioner Dr. Kelly Foster is on the line, and maybe Marty Park from OET that might be able to add a little more clarity to your question.
Sure. Good afternoon. When you all approved for the K through 5 back in May, the way that was presented to you all, that if additional requests came in after that special called board meeting, you gave the commissioner authority to approve those as they came in. So, we've had a few trickle in over the summer that were not part of the original 109 that requested in May. So if additional requests need to be made, they can. Marty, are you on the line?
Absolutely. Thank you, Dr. Foster. And that's an excellent question. And just for clarification, we had an original 109 of our school districts had submitted for that waiver request. And we are now up to 116 school districts who have been approved for that. So we are. We also are receiving updates to those plans that are extending grade levels when and where that's a fit. Okay, excellent. And the other question I received, because originally under the past, we were given districts additional days versus the 10 NTI days. Part of the thing is, if first of all, hopefully, as Patricia said, that in implementing the masking mandates, we don't keep seeing students increasing out. But under the situation, let's say that they're in a district that has 3 schools or 30 schools, it doesn't matter. But if one school, there was an outbreak within one school, the district closed that particular school to stop the spread, but the other 2 were not being affected, middle or high, for example. That would not count as an NTI day presently against them, correct? They would have the authority to quarantine or to try to stop the spread, but if you got 70% of a school out, obviously you don't want to go on with instruction there because you want to quarantine the other 30%. So helpfully they might go mobile, but it's kind of like an emergency situation, like, that we have where you have a water main break or something. One school is closed. They can apply for an emergency under that. So it didn't count for their
one of their missed days of the NTI instruction if they went virtual for a day.
That's correct, Dr. Poe. NTI days are really intended for the closure of an entire district. So if you had to close one school and you had a number of students that were quarantining within that one school, in that hypothetical, it would not count. The NTI day would not count against the whole district. And we have also created a process where school districts, if they're delivering instruction to students who are quarantined, they can continue to draw average daily attendance for funding purposes for those students as well.
Okay, that led to my next question. So I'm glad you asked that or explained that and brought that up. So under the past two things, the districts also, so a child in quarantine does not count against them as an absence if they are learning virtually at home. They can count that child present under this current reg or regulation or in the past. Correct?
Approved at the last meeting, yes.
Okay. I appreciate the clarifications on those because, we don't like to sit there and say the different things, but if you're sitting there as a school superintendent, you're wondering how you're funding these different things. And I know the ESSER funds that they can utilize for that, but the big thing is that they're concerned about is trying to mitigate people being out of school and being in school, but some students will need to be quarantined. So we want to make sure that we're not penalizing those students that also have to be quarantined and counting them as absent. Thank you.
All right, thank you. And I have the following queue with questions or comments. Ms. Sloan, followed by Ms. Adams, followed by Mr. Johnson. So Allison.
Thank you, Ms. Young. I wanted to say that last night someone put a poll out with our educators and our faculty and staff in our public schools and just kind of wanted a yes or no answer on whether they supported this mask mandate. With the sample size that we got back at the time, as of 11:30 today, 94% of those that responded were in favor of a mask mandate across the state in our schools, and that was just with people in our public school systems. And with that said, I want to add that I'm getting personal messages from educators and school employees fairly frequent and consistent over the last couple of days. And much of their concern is that, just like Soyana said with the students, is they don't feel like they're being listened to at the local level. And this is not, of course, statewide. There are some districts that are doing an excellent job of using teacher voice and bus driver voice and cook voice and student voice to make those decisions. But many of our districts and our board members, our teachers are saying they don't see them in their building. So they're having a hard time understanding how they are making the decisions they're making when they're not there to see what the teachers and the students are doing every day. And I can say during this pandemic, I've been at the elementary level, my son was at the middle school level, and now I'm at the high school level. And I can tell you firsthand experience that our students do perfect with their mask. I mean, day in and day out, there are small issues, but our students are very much adaptable to what we present to them and what we have a positive attitude about. And that comes from both home and school. This year alone, I've seen students at the elementary level. They're happy. They do what you ask them to do. They want to please. And even we had open house at the high school level recently, and there was not a person one that I saw that was not wearing a mask, and there was not a complaint one that I heard about having to wear one that night. So I think it comes from all around, and the more we can be positive and moving forward, this is a small thing, and I know we've all kept saying that we can do, and we want our kids in school. We want to be able to educate them, and this is very small that service that we can all put in and have great attitudes around it so that we can keep our doors open this year. But I think I wanted to share that, as of right now, a huge portion of our public school employees and our teachers and everyone who works in our schools supports this mandate.
Thank you, Allison. Ms. Adams.
Well, as a former language arts teacher, I usually have to bring in a quote or a poem about what we're discussing. I have a quote today by Reverend Miles Monroe. Our life is the sum total of all the decisions we make every day, and those decisions are determined by our priorities. And what I'm hearing overwhelmingly from students, parents, teachers, administrators, the entire community is we want our kids back in school in person, and we want them to be there safely. So any decision we make is only to keep our main priority, and that is to keep those kids in school. And if masks will help us do that, then that is a decision that I hope we can make today. Thank you.
Thank you so much, Joanne. Mr. Johnson.
Yeah, I just want to echo what, go back to what Dr. posed the question he asked
Yes, sir.
earlier today. All the emails that, a lot of them that I read seemed to think that the decision we made today would either do away with the governor's mandate, which it does not. You know, that mandate is going to be in place regardless of what decision we make today. I just think that was Dr. Poe, that was a great question you asked, and we got it clarified. What we do today is just based on the authority that rests with the Kentucky Board of Education. So good question, and we do want to make sure we keep our kids back in school. And if this helps to do that, if the masking is helping to do that, then I certainly think that we should be in favor of that. Thank you.
Thank you, Mr. Johnson. Well summarized. Now I have Lee Todd, followed by Claire Batt and Patrice McCrary. So Dr. Todd.
Thank you, Chair Young. This is an extremely difficult issue. We thought we were putting it behind us when we were dealing with just COVID-19, and then all of a sudden Delta shows up, and it's something we don't want to have to revisit. But clearly, as people have said, we want students back in real-time learning face-to-face as much as possible. And we're basically at war with this virus. It's really it's just taken over the country. And when you have something like that, you've got a complex problem. You got to gang up on it. You got to use all the utilities that you have that are proven, that are known. And people need to look at the research that they can find on their own, read it, and see that the tools that we have are vaccination, masks, social distancing, hand washing, and the ones we've heard of before. Let's use them. I think the children of Kentucky and the students of Kentucky can lock jaws with this thing and say, I'm wearing a mask to solve a problem that's facing our home state, and it's really taking a toll. I look at some of the statistics that we have in these documents that you provided, and you see some counties maybe have 0.2%. That's pretty low. But you look next to the column to it, it says 8 people have died. That's 8 families that have been affected. We don't need that. We've had 600,000 people die because of this virus up to this point. And it's time that we just lock our jaws and do what we have to do. And I support what the governor's done all along to try to bring this issue to the forefront, try to get our citizens to be leaders in the nation to show that we can take on the responsibility of getting rid of this virus so we can get back to normal. So I support it and appreciate the comments, especially from those teachers who are in contact with students and in contact with teachers, and see what their capability is. We don't have to assume they're not capable of doing things. They are capable of doing things that they decide to do. And I think it's time for them to step up, and I believe they will. Thank you.
Thank you so much, Dr. Todd. Ms. Batt.
Yes, I just had a couple comments that I wanted to make, and I am such an advocate for local control, but I think in this situation, we know that people across the strait travel from one area to the next. And so there's no local anymore. We are too interconnected. We travel, we go to the next town, and therefore we transmit this virus between our communities. And this is, as Dr. Todd said, this is a time when we sort of have to lock our jaws and join together. And as a community, look at what the best things we can do to protect all of our kids and to keep them in school. One thing that has not been talked about very much is, kids, the evidence that many kids are experiencing long-term symptoms after becoming infected. Although they don't show a great deal of sickness while infected, many are coming up with symptoms that linger and last. And I think, as an adult, the last thing I want to do is condemn a child to have a long-lasting illness or something that's going to affect them for the rest of their life. And so I also spent some time last night reading emails and then looking at other countries where they have tried a different approach, where there's a high rate of vaccination and a very low rate of infection and death. And I just would love to urge our people in Kentucky to consider trying to do the same thing. And let's join together and put politics aside, look at the science, and do what's right for our kids. Thank you.
Excellent. Thank you, Ms. Batt. Board members, if you have a hand up and just failed to put your hand down, would you please do that just to make sure I'm recognizing those who want to be recognized? At which time I will go to Patrice McCrary.
Thank you, Chair Young. I just want to follow up on what I said earlier about the large district that has the large number in quarantine. I applaud the superintendent of that district. Before any mandate was put in place of any kind, he did place a mask mandate on the district in order to calm down what is taking place within our schools. But that is a cautionary tale. Because of beginning that early, we have seen what can happen. So first of all, I applaud him for the courage it took to step up and do that before, and the support of this board to do that before it became more of an issue. But it can happen anywhere. Second of all, I do have a question, and it goes back to with this, if this goes in today, how quickly is the turnaround on a board meeting? What is the protocol that we follow? My understanding, it has to be posted. So, but I think that's a pretty quick turnaround, if I'm not mistaken.
And do you mean in regards to withdrawing the regulation at the appropriate time? Yes. So we would immediately call when we get that recommendation from CDC and or Department of Public Health, we would immediately call a special call board meeting like today. And then we would consider action to withdraw this emergency regulation. And then Todd Allen would in turn write a letter to the Legislative Research Committee on our behalf, withdrawing the regulation within a day's time. So it is a speedy process. That was one of my questions to Patrice. Again, trying to help folks to understand that it is not our intent. The 270 days is not ours.
And Madam Chair, if I might further clarify that. So how this might work, based on what we heard from the local superintendent's advisory council this morning, they've asked that we work with the Department of Public Health on potentially a localized matrix similar to what we had this past spring. So I will reach out and do that. If they were to come forth and say we're switching to some different recommendation, that would trigger immediately the board meeting. We would have to notice the meeting. We'd have to hold the local superintendent advisory council meeting again, but they, to their credit, they've been great about coming together on really short notice and giving us good feedback. And then we'd have the board meeting. So potentially how it would work is once we get a change in any recommendation from CDC or from the Kentucky Department of Public Health, 24 hours after that, we potentially would be having the board meeting to make an adjustment with notice and the local superintendent's advisory in between.
Excellent. Thank you so much. And then I think I have Dr. Poe, Ms. Batt, and the Lieutenant Governor. Oh, Randy, you're still muted.
Yeah, thank you, Chairman Young, and thank you, Commissioner, for your clarification. I want to say that I really appreciate the clarification you gave from LSAC and the willingness to work on those local metrics that you were saying, and try to get to an approach that at least we had last year, that we can look at local decisions if this is not a statewide effort that you're saying. I, like my fellow board members, this was not an easy decision to come to, but at the same particular time, I want to thank the department for educating us and asking or clarifying our particular questions, because I think that makes it for an easier decision for us. But, I, like Claire and the others, I've been in effort for a long time of local control and doing what's right and using parent choice in our buildings. However, after I continued listening and reading multiple emails, some of the things that they've actually changed my mind. This is not a political decision. This is for us a medical decision for our students to stay in school. We've said all along we want our students to stay in school. I, like Patricia, talked to several students. I was actually in Warren County on both of those days, before the close and after the close. I also saw the protesters out front, but I also talked to the children. And the children said, if I need to wear a mask, then so be it. I'll wear a mask to stay in school because I want to be in school. I want to be with my friends. And the students actually there in several other counties that I was in yesterday talking to students and getting their feedback are the ones that helped me come to the decision that this is a decision, an educational decision that we're making today to stay in school. And the fact that Commissioner Glass is working with LSAC and working with the ones to maybe come up with good, solid metrics that we actually do use, and people don't think that we're just reacting to this or reacting to that, has made it, that decision. And then I looked at KASA today. KASA, quoting KASA, that in order to keep students in school masking for 30 days to keep this virus in check is one that we can do. We know at the end of the 30 days, if we save lives and so forth, that's what we're going to do. And if it takes 30 days to get this thing on the downward spiral, then I'm all for that. But I do hope that and I will say this, in the caveat, I do hope within that 30 days that our health departments do get solid metrics together for us so that superintendents and school districts and school boards can make some local decisions in this so that we're not trying to do one size fits all. So I do thank the KDE and looking at that and working with there, and that after this 30 days that hopefully we can get back to where we were thinking that we were on last Monday or so. So thank you for all your work that you've done.
All right, thank you, Dr. Poe. Just to clarify, 30 days doesn't apply to our regulation, just for clarity there, but certainly hearing what you're saying in response to LSAC, we will absolutely capture that in the motion.
Correct, but I do want to state, because of the clarification, just as Alvin Johnson and I talked about, we did say if the emergency was being lifted from the governor's executive thing, that we would be meeting to look at that particular potential so that people don't think that we're going to do this for 270 days.
You're on the right track, yes. So not at the end of the 30-day period necessarily. So we still have some comments here, but the motion that we would consider would add language to monitor guidance from the Centers for Disease Control and the Kentucky Department of Public Health, and immediately call a special meeting of the Kentucky Board of Education to consider withdrawal of 702 KAR 1:195E if either CDC or DPH relax their recommendations of universal masking in K-12 schools. So it's just clearing up the fact that we don't have a time limitation on our regulation.
We do not have a time limitation, but if you're telling, I guess my clarification, if you're telling me that we're going to mask for 270 days without looking at the governor's orders and things, that changes where my thought process, because my clarifying questions were that the governor implemented an executive order for 30 days. We're implementing a separate order, totally separate from that, but that does not preclude that. But if our governor comes back and says that we are free to go about and he's withdrawing executive orders, we should be looking at that as a board, are we not?
I'm going to let Dr. Glass.
I guess I'm getting mixed messages, and that's how I think the people feel out there, that we're doing something totally for a longer period of time. And if schools are going back and kids are there and the rates are dropping, even if the CDC doesn't say something, we surely can come back together and look at Kentucky versus the rest of the nation.
Yes, so we have Kentucky DPH in there as well. And so, yes, heeding the LSAC, the second part of the LSAC recommendation today, yes, is part of the motion. Jason, anything you want to add there? Randy, my apologies if I confused you there. Just wanted to make sure that we understand that our action today is separate from that of the governor.
Correct. I understand that, but I want to make sure that what I heard the commissioner say, and I'll let him clarify. My interpretation was that he was, based on those LSAC recommendations, going to work with their and try to come up with clear metrics that we ourselves, KDE, are going to look at for local control so they can make decisions in the future if one county's red and one county's yellow or green, whatever the colors are, that they can, you know, Northern Kentucky and Western Kentucky and Eastern Kentucky and South Central are totally different. If there's an outbreak, surely we want to shut down there, or those superintendents do. I would think they would. But if I'm clearly in an area where there is not an outbreak and the people are getting vaccinated, like Lee Todd said, you know, that's how Dr. Todd said how we get out of this. If 80% or 90% of an area or region says, hey, we're going to get vaccinated and this thing is clear, we should not be making them wear masks then at the same time if they're stepping up to the plate and getting vaccinated.
Thank you, Madam Chair. What I would clarify is that what's in our recommended motion for you includes a trigger factor that if CDC or Kentucky Department of Public Health changes their recommendation, then we will have a meeting. So immediately following this meeting, that we're in right now, I intend to reach out to DPH and consult with them on, can we create a similar sort of color-coded system that we had last year? If DPH were to then change their recommendation of universal masking to be something that's based on positivity rates or perhaps vaccination rates in a community or some combination, that would immediately trigger the board meeting that we're talking about. If that didn't happen, there's nothing that would preclude this board from meeting tomorrow, or I guess we'd need 24-hour notice, but meeting on Saturday to talk about this in a different way. So you can hold as many special meetings as you want. What we're suggesting, though, is to build something into the motion that you have that clearly communicates that it is not the intent of this board or the department or me to keep kids in masks for 9 months. No one wants that. That, again, is based on the language that's in the statute in Kentucky around emergency regulations. This wasn't something that we put in or we wanted to put in, but we want to clearly communicate that it is not our intent to keep kids in masks for 270 days, and also communicate that we are monitoring this very closely, and we want to, as conditions continue to be dynamic and shift, we want the requirements that we're asking schools to put in place to control and mitigate the virus to shift with that.
Excellent. Thank you so much.
Thank you, Commissioner. That clarifies.
Thank you. Claire Batt, followed by Jacqueline Coleman, and then I believe we may have a motion prepared for the floor. Claire.
Yes, I have been in communication with a teacher in a sort of a Southwest district who has a superintendent who has refused historically to require masks. Last year, this was true, even though we did have a metric. And I've heard from him and a couple other teachers who wanted to know what are the repercussions in that situation, because they feel certain that that is what will occur again, despite the mask mandate, if we do enact this regulation. And I'd love to hear a response to that question.
Thank you. Thank you, Board Member Batt. We have been closely researching and evaluating what steps we would take in the event of a circumstance such as you're describing. And my very unsatisfactory answer is it depends. And it's going to depend on, are we talking about an individual student or a group of students? Are we talking about an individual staff member or group of staff members? In that case, school districts would need to rely on the student code of conduct and their employee discipline procedures to manage and get compliance with the requirements. If we're talking about an institutional action, so either the superintendent or the board is defying the law, then we've got a different set of circumstances. For the educators that are involved, particularly a system leader, they have a requirement as part of their license to follow the laws in the state of Kentucky. So potentially they put their license at jeopardy, and certainly it would be investigated. So that's one potential consequence. And then also we are considering other options that relate to closures and funding concerns that may come up. We don't want to use any of these, and it's our belief that that our school leaders and school boards are law-abiding, that they will largely follow the laws. And if they have problems with the actions that the governor has taken or the actions that the state board is considering today, the right place to solve that is in court. And the court will decide whether or not these regulations and orders are legal and stand up. And that's how we operate in a nation and a state of laws.
Thank you so much. Lieutenant Governor Coleman, followed by Dr. Robinson.
Thank you so much. I told the chair that I wanted to wait and let the voting members kind of share their questions and concerns first, because I do not vote on this, but this regulation does require my signature as the secretary. And then, of course, I will be advising Governor Beshear on all education issues as well. So I just want to kind of go back to a couple of the things that we have heard here today, which is, the first is that this is a matter of local decision making. And I support local decision making when it involves local issues. We're dealing with an international crisis right now, health crisis, and it is burning across the United States, and it is mirroring exactly what we're seeing in Kentucky. I think Robin Kinney just shared those numbers with us about our numbers here in Kentucky. Our hospitalization rates, our ICU rates, our ventilator rates have skyrocketed just in the last couple of weeks. And nationwide, the COVID infection in kids has gone up 80% in 2 weeks, 80%. And we have a hospitalization rate for kids that has tripled across the country. So this is not a matter of, Mercer County is different than Caldwell County. This is burning across this state at an alarming rate. And when asked, why don't we delay? That blows my mind. We have kids right now who are on ventilators in hospitals and being quarantined, which means that they can't go to school, which is what we want, is for them to be in school. It also means their parents can't go to work. I mean, I just think about the tragedy that would keep repeating over and over and over again. And I'm just going to be very honest with you. You all know I like to be blunt sometimes. It's the coach in me, but failing to implement a mask requirement, in my opinion, is negligent. Given all of the information that we have and that we have gone over and over and over, time and time again, that is negligence. We would be knowingly endangering our children if we allowed this to continue and just willfully stood by. And, my question is, do you want kids back in school? If the answer is yes, get vaccinated and put on a mask. Do you want kids to be able to play sports? If the answer is yes, get vaccinated and put on a mask. Do you want to go to work? If the answer is yes, then get vaccinated and put on a mask. I'm grateful for the leadership of this board. This conversation today proves why it is so critically important to have voices of educators at the table and students as well, because we've heard from students, thanks to Chair Young sharing what their voice is. But these are folks who have real experience in the classroom and who understands what this means at the grassroots level. They are boots on the ground in the trenches with our kids, and they're the ones that would have to deal with the mass casualties that would result from just being negligent in this situation. And so I just want to say thank you all for your leadership, for your thoughtful questions, for your consideration, and for following the guidance and advice that we're getting from the experts and putting aside any kind of politics that are bubbling up in other parts of conversations that we've heard. This is truly about keeping our kids safe and doing the right thing, and doing the right thing is sometimes hard. And so I implore you to make tough decisions. That's why you're here. And to make the decisions that are in the best interest of our kids. So thank you.
Thank you. Thank you, Lieutenant Governor. Dr. Robinson.
Thank you, Madam Chair. I have a motion, and if I get a second, I would like to speak to my motion.
Sure.
I move approval of 702 KAR 1:195E as presented, and to instruct the commissioner to monitor guidance of the Centers for Disease Control and Prevention, the CDC, and the Kentucky Department of Public Health, DPH, and immediately call a special meeting of the Kentucky Board of Education to consider withdrawal of 702 KAR 1:195E if either CDC or DPH relax their recommendations of universal masking in K-12 schools.
Thank you so much, Dr. Robinson. We have a motion. Do we have a second?
Lee Todd, I second.
We have a motion and a second. Thank you so much. And as we begin further discussion, Dr. Robinson.
Madam Chair and Commissioner Glass, I want to thank both of you for your leadership. Lieutenant Governor Coleman, as I watched the press conference on Tuesday, I swelled with pride at the leadership in our state that was seeking to inform and to inspire us that we can manage in the midst of a pandemic to educate our children and keep them safe. I was so proud to be a part of Team Kentucky, and I am really proud of the discussion that we have experienced today, which was on a foundation of really good information and really amazing, smart, strategic thinking about how to engage all of the components of a comprehensive strategy to keep our children safe, keep our economy strong, and to observe the ambitions and nurture the ambitions of our students to become contributors in a growing economy. I have a hard time separating education and our economic well-being, because I think that forms the keystone to our social and civic well-being and the potential of living in a thriving democratic society. So board members, I have just so been inspired by your engagement, the degree to which we read emails that we thought would be predictable, but turned out to be informative, both those that were for and those that were against. I felt like we have demonstrated our willingness to be exposed to the thinking of others, to support our decision-making, and now the moment is upon us. So I'm pleased to have had a chance to offer this motion.
Thank you, Dr. Robinson. Claire Batt, followed by Dr. Glass.
I just want to thank all the parents who have written and expressed their thoughts. I really appreciate that you are an advocate for your child, but I do urge you to consider the importance of this act in keeping your child safe, and we really respect the thoughts that you have offered us. Thank you.
Thank you, Claire. Jason. You may still be muted. Yes.
Thank you, Madam Chair. I am sensitive to and understand that there are many different perspectives and opinions on the question that's before you. We have, in this case, positive but also competing values that we are wrestling with and trying to think through, and that our local communities are wrestling with and trying to think through. From my perspective and in our recommendation to you, the values that we put forth are based on the health and safety of our students and their educational experience, and putting that first and foremost in the decisions that we make, and that those supersede other values that may be playing out in part of this decision. We presently stand at a place in the nation where we're losing 550 Americans a day to COVID. At the height of this virus, we were losing over 5,000 Americans per day. So currently, that's like someone shooting down 2 757 airliners full of Americans every single day. And if we rose back to the level at the height of the virus, it would be like losing twice the number of Americans we lost on 9/11. If some other foreign nation did this to us, we would consider it an act of war, and we would immediately unite together to combat this. So, Madam Chair, I rise in support of the motion and the second, and recommend that we do what it takes to put this virus behind us once and for all.
Thank you. Thank you, Dr. Glass, for your clarity and for your willingness, as you've said before, to be unambiguous in this recommendation. Board members, we have a motion and a second. Any further discussion?
Call for question on the motion.
Call for the question. Thank you so much. Meredith, would you please call the roll?
Joanne Adams.
Joanne Adams, yes.
Claire Batt.
Claire Batt, yes.
Holly Bloodworth.
Holly Bloodworth, yes.
Jamie Bowling.
Jamie Bowling, and I'd vote yes.
Alvis Johnson.
Alvis Johnson, I vote yes.
Patrice McCrary.
Patrice McCrary, I vote yes.
Randy Poe.
I vote yes, and clarifying, based on the things that the motion was altered from its original version. So I thank you, Commissioner, for doing that.
Sharon Robinson.
Sharon Robinson, I vote yes.
Lee Todd.
Lee Todd, and I vote yes.
Lou Young.
Lou Young, I vote yes.
All members present have voted.
All right. Thank you, everyone. Thanks again, too, for your diligence, your willingness to meet for a special called meeting and for another productive conversation in the best interest of the children and families we serve. Thank you again, board members. At this time, I think we are ready for a motion to adjourn this meeting. Do I have such a motion?
I make the motion.
Thank you, Ms. Bowling.
Second.
And thank you, Ms. McCrary. We have a motion and a second. Meredith, would you please call the roll?
Joanne Adams.
Joanne Adams, yes.
Claire Batt.
Claire Batt, yes.
Holly Bloodworth.
Holly Bloodworth, yes.
Jamie Bowling.
Jamie Bowling, yes.
Alvis Johnson.
Alvis Johnson, I vote yes.
Patrice McCrary.
Patrice McCrary, I vote yes.
Randy Poe.
Randy Poe, I vote yes.
Sharon Robinson.
Sharon Robinson, I vote yes.
Lee Todd.
Lee Todd, and I vote yes.
Lou Young.
Yes. Thanks, everyone. Megan, we are adjourned.